Hi, good evening. It's Tamara Carroll, and I am here with you for Life with Lipedema, loved, valued, and treasured. And I'm so happy that you're joining us today. Please drop into the comments where you're joining from. And I want to invite you to be part of the conversation tonight. I know we can't be on screen together, but I would love it if you would put in your questions and put in your comments, and we'll be sure to bring it forward and bring you forward into our conversations and hear your voice, even if it's through text. Hi, Melissa. Welcome from Wisconsin. Yay, that's incredible. So, as always, I like to start with a little inspiration of some sort. And because I was thinking about my guest tonight, and she's a personal friend, I was thinking about how iron sharpens iron. And so this is a little proverb. It says, as iron sharpens iron, so a friend sharpens a friend. And I just love that because I think that we can learn so much from each other. And those of us that have had the diagnosis or have had the education more longer, or even what we tried and what works and what doesn't work, I believe that's iron sharpening iron. And it's just a great way that we can grow our friendships and just really learn from one another. So, my guest tonight is someone that I know in real life, not just online. And we actually met each other. I did a sourdough bread making class. I was trying to ask her the other day, how did we really get connected? So I had a sourdough bread making class, and she came to my class. And then from there, we spent crafting together and just hanging out in real life and having lots of conversations. And so I have a little group on Facebook that is, hi, Kim, that
Hello.
is that is called, Eastern North Carolina Lippy Ladies or something to that nature. And so she and I had been talking about compression. She's been using it for quite some time and had some experience with it. And first, I think we were saying, well, let's just get together maybe in one of our groups, in real life, because we have met with the Heart to Heart ladies, one time here in New Bern, and just being able to share about compression. And then I said, oh gosh, you got to be on my podcast and come and share with all the ladies, not just the ladies in our immediate area. So I'd like for you all to welcome Kim Gelletta. Make sure I say your name right. And she is a retiree just trying to navigate the world and live her best life with lipedema. She lives on a sailboat here in North Carolina. So doesn't that sound fun? Hey, Nancy, thanks for joining. So Kim, can you take just a few minutes, maybe 5 minutes or so, and just share a little bit about your story with lymphedema, when you kind of started feeling like things were different for you, and maybe a little bit about your diagnosis.
Well, I think my story is probably pretty common for women of our age. I think that, that physicians did not know what it was here in
Mhm.
the US. I mean, they've known about it in Germany since I think my husband was looking something up and said 1940s. But here in the
Mhm.
US, the physicians did not. And so it was just you were fat. We all know
Mhm.
that. And so that's what I thought. And, I would look at other women that were, bigger women and think, my gosh, her body is so well proportioned as opposed to mine. So I didn't know what I had, obviously, other than,
Mhm.
being ashamed of it
Mhm.
and knowing that really nothing seemed to work with it. And then during COVID, I was working from home and traveling back and forth from Wisconsin, which is where I was living, to Michigan, northern Michigan, where my mom lived. And the family needed help. So I was every 2 weeks going back and forth.
Mhm.
And that caused my lower legs to just explode. I had had some swelling issues before, but I could usually keep it down. And so I ended up going, and how it was during COVID, you really couldn't see a doctor. But I got into a doctor who was not my primary, and he looked at me and he said, oh, that's lymphedema. I'll send you to a physical therapist. And that
Wow.
was the first time I ever heard the word lipedema. And she saw me and she's like, okay, well, yes, this may be lymphedema, but that is definitely lipedema you've got in your thighs and your upper arms. And there's nothing you can do to make it go away. She says, you can do liposuction. That's it. And, you know, we know that insurance doesn't cover liposuction unless you have some amazing insurance. And so I started with compression. You know, they start when you come in with the swelling legs, they do the ACE wraps to try and get it down. And then I went to these Velcro wraps. And I do have some with me.
Yeah. Show us.
Well, these are horrible to wear. If anybody's worn them, they know. They're effective. So this one is a Juzio. I think that's how you pronounce it. And it comes with, you could go either side. You could go the tan side or the black side. So they're stylish with what you're wearing. And they wrap around your legs and they help keep the compression down. And so I walked around and slept with those on for a long time. And that was how it was going to be. And then when you're trying to sleep with Velcro, I don't know have you tried the Velcro wraps yet, Tamara? I
don't even wear compression. I tried them once and I kept them on, and then they dig into my skin
and they attach to everything. So you're trying to sleep and they attach to each other, which is fun too if you're trying to go to the bathroom in the middle of the night. So then I from another Facebook group, somebody had mentioned that they were wearing these things called Tribute nighttime. And they look like a quilt. But they're not as tight as the Velcro wraps. And they're very effective, other than the fact that you are wearing a quilt to bed. So that at least made life bearable. And I was coming home, you know, I just accepted that this is the way things were going to be. I was coming home from, I think it was work, I could be wrong, one day. And on Wisconsin Public Radio, there was a discussion about lipedema. And the woman was talking about how some insurances are now covering it. And I was just getting ready to retire, or had just retired, one of the two. And so my plans were, my husband and I had sold everything. We were going to take and go sail around the world. And then 2 years later, we're still sitting here because now we're doing the surgeries. But,
before we move into the surgery part, I want to kind of go back to the compression. You showed us two different ones. Now, is it common for people to wear compression at night? I had not heard that before.
I think it's pretty much like 24/7.
Oh, okay.
I at one point had kind of had it settled down enough where I could wear it at night and like maybe not during the day to go out. But most of the time it's you know, if you're not showering, you're wearing it. And I'm actually to the point where if I don't have compression on my legs, they feel weird because I'm just used to having that compression. And
now,
it's also common. Apparently, a lot of people they double up the compression. But I've always done just the knee-high stockings, and then mostly I was able to wear regular leggings. At this point, because of the surgery, things have changed again. You know, anytime there's a life change, it changes what you're doing. So you get in a nice routine, and then you know menopause hits, or you get pregnant, or you whatever your life change is that causes the hormones to change, and you have to work out a new normal. And so I have been using the compression is usually like in the 2 levels. You've got the lighter compression at like 15-20, and then you've got the 20-30, which is more the medical. And just in case somebody isn't aware of it, it's graduated compression so that it's tighter at the bottom and lighter at the top to kind of cause the blood flow to move up. Just as if you were doing a manual lymphedema massage.
Okay.
So after my surgery, after I had been wearing, like I said, the 20-30s, after my surgery, I had a real hard time. Everything was, pitting and I couldn't get the compression, the swelling under control. And then when I switched to a pair of pants that were the 1520, it kind of helped even that out a little bit. I'm still having swelling issues because it'll happen. Apparently for like up to a year it can happen.
Yeah, that's kind of what I heard. So the Juzio, how do you say that? Juzio?
J-U-Z-O. I call it Juzio, but I could be, wrong.
So you can order those without having a prescription. Is that right? You can order them. And then can you hold those up again? Are those the ones that have the Velcro that wrap around? So you don't have to pull them on the pantyhose.
Yeah. So the way they work is you've got your piece. This is a calf piece. And then it's got Velcro on each side. And then you take the Velcro and you cross it. And then you pull it until you get it nice and tight. And then you put the Velcro on.
Okay.
And so it can be adjustable during the day. So like you wake up in the morning, it's you put it on right away. So your swelling is down. You get around, moving around during the day. It may stretch it out a little bit. You may have to pull it a little tighter, that kind of thing.
Do you know if they make them for the full leg or is it just the calf?
Pieces. So you have a thigh, a knee, a calf, and a foot. And then I'm actually currently in the midst of ordering for my arms. So I'm getting it's the upper arm, the lower arm, and hand. That's
and I've seen those. They have some that are really cute. They actually look like tattoos or something, like for the arms or whatever.
Well, and after this surgery, I may end up wearing those forever. I've not done the sleeves. I was told it's lipedema. Compression's not going to make a difference when I first started. So I never got the arm compression like some people do. But my understanding is after the surgery, once he gets it, because it's going to, basically it's a restart. It doesn't make it go away, but it moves you back. So once I get that restart, I will probably have to start wearing compression all the time on my arms too.
So the tribute ones, the ones that are more like a quilt, could you hold those up again for me? Yeah. And do those get really hot at nighttime? I run really hot. I'm like, I'm always
ripping my blankets. They do a little bit, but they are so good. They really, really, I wake up in the morning and my legs are down to the size they ought to be.
Wow.
But that I think is the lymphedema, not the lipedema. But they're so much more comfortable than the other options. It really did make it so I could sleep at night.
So how would you order? Like, do you have to measure your legs or how do those?
Physical therapist.
Okay.
I haven't looked up how to order those because they did order them for me. And I don't know the exact details, but last year they passed something in Congress with for lymphedema and made it so that they have to cover your compression now. So when I got my compression the first time, I had to really fight for it. And, with more advanced disease, your body can't wear the stuff you just buy over the counter. They just won't stay up. I do have some stuff. They make like body glue. This one just happens to be by Juzo. But this you put around like the top of the calf. And then
that's always my fear. I've been thinking about getting
these
kind of the thigh high ones, and I'm always like, oh my gosh, what if I'm out and they just fall off of my legs? so that adhesive helps it stay up, right? Oh, she's kind of glitching.
Yes, and if I use,
So that solution that you showed us.
Is this me losing you?
Yeah, you're kind of glitching a little bit. We'll wait for a minute. Hopefully she'll come back. So let's see who's here. Sonam, hi, Nancy. So glad you're here. I saw there was, hey, there you are. You're again. And Susan and Sandra, thank you for joining. Let's see if can you hear us okay? You hear us okay, Kim?
Okay, I can hear you. Yeah, it was having trouble. Oh, Mount Pleasant, Michigan. My sister lives right by there.
Yeah, yeah. And then there was a gal from Wisconsin too. So I didn't know if she was your friend. Yeah, there's Melissa.
No, I didn't tell anybody I was doing
Oh,
this.
you got to share. That's why your friends want you to share, remember? So Sandra is saying that she can't get anyone locally to order from Medicare. So perhaps you need to see a physical therapist that specializes in lymphedema, and they would be able to do that for you. I think that would be, or maybe a good vein doctor.
Well, and the nice thing about the physical therapist was, especially at the very beginning, she was able to help me. Like, so my ankles were a rough spot. So she made little pucks to put in there. They have a whole lot of tricks they can use. She also taught me to do my own manual lymphatic massage, so that I can. It's not as good as somebody you go and pay a bunch of money to, but you can do it whenever you are sitting there. So that's kind of nice. Yeah. So what I did is, like I said, I went through and she helped me with the compression to get it all down, and then she ordered me my custom compression, and like I said, she taught me to do the manual massage, and then I found out that I could get covered by surgery, and I kind of just forgot all that. Oh, I also she got me a and you have one too, the pump. So it's the sleeves that you put on, and they pump up your legs like a manual massage. The problem with this disease is it takes so much time of your day.
It does.
It is a lifestyle. You have to get up in the morning, you have to do the massage, and then you have to wear the compression, and you have to do the pumping, which is like an hour a day. If you're being really good and diligent about it.
My guy wanted me to do 3 times a day. I'm like, who has time for that?
Well, in the beginning, especially until you get things down under control, it takes your whole day. And then you've got the whole, you need to find time in between all of that stuff to moisturize your skin and really try and protect it, because all of this stuff really breaks down your skin, leaving you open
and then
for
using the right types of lotions too, without having all the parabens and you got to be careful. You got to be careful what you use, even the fragrances. You want to be as clean as possible.
Yeah.
Well, good. I know there was somebody asking about the company. Lipedema Simplified can't. We can't. What do you call it?
Oops, I didn't mean to mention the company, sorry.
But I'm sure if you look it up, the Juzio, that's spelled Juzio, I believe. Right?
No, Juzo.
Juzo. Yeah. And then Tribute was the other one that was more like a quilt. And then you were just holding up one that had like a band around the thigh, that you were showing with the
that was the Juzo. Yeah.
Okay.
Yeah, that was the Juzo. And there's a couple different companies, because my first ones were not Juzo. My first ones were a different company, that the insurance company that was the one they used. And same with your compression pants. There's a million companies out there, and it's just a matter of trying them. After my surgery, they had put me into a new brand I hadn't worn before. Didn't like those too much. And that's why I said I was having some issues with swelling, and I came across, it was just something on Facebook, and it was like, oh, this company's going out of business and they're selling off their stock. I don't know if they're really going out of business, and I hated them when I got them. I'm used to wearing ones you could wear that look like leggings and get away with it. But as much as I hated them when I got them, they were the thing that actually helped me get the swelling kind of under control. So, it's a matter of just kind of searching around till you find the type you like. And then I
Yeah.
bought, 5 pairs. So,
Right.
so I have one for every day.
Steph says, I'm in Omaha. My doctor's office did a support group meeting locally with 3 OTs in our area who can custom fit compression, pump devices, and massage. I feel so fortunate. Yay.
Oh, that is. Yeah. Yeah.
That's
Considering
good
so many
news.
of us, it's like, oh, the doctors don't even know about it. You're actually educating them.
Yeah, for sure. And Lipedema Simplified has all kinds of literature that you can download from the Lipedema project. And there's also doctors on there. And so you may have to travel a little bit to find somebody who is well recommended, but the literature is great. You can print that off for free. And give that to your doctors and be an advocate, and not only for yourself, but helping them.
Yeah, and the more you know about it and about what's available in your area, the better off you are when you go to your doctors. When I was trying to get my surgery covered, I worked with a group that's no longer active and has some issues, but they were fabulous for me. They helped me by giving me a kind of a form to fill out, telling me what procedures, I needed to see the physical therapist. I needed to get this done. I needed to get that done. And so that when I went into my meeting at the insurance company, my appeal, because obviously they turned me down in the beginning, they were kind of like, wow, this is just amazing, that all the stuff you've done. And they have still, they're still, they're an insurance company, so there's still problems. But it was not the as bad as it had been in the past. The stories you hear from some people, they at least said yes, even though they then tried to back out of it and things like that. But part of what helped me with finding a doctor is I went in knowing that there was nobody in my area that had the ability to do the procedures. So that that was part of what helped me get the doctor I ended up wanting. Because I'm from Wisconsin. My insurance is from Wisconsin. I live in North Carolina because I'm retired, and my doctor's actually in New Jersey. So, and you shouldn't have to do that. To treat this disease, we shouldn't have to travel over multiple states to see a doctor that knows about it. And can treat it safely.
Yeah. Susan's, I know she asked what kind of lotion. I use a brand called Jordan Essentials, and it's very clean. And my MLD therapist, he looked at the ingredients and he said, yes, that was a great thing to use. I don't know, do you have any special lotions that you like for your skin, Kim?
I use the hemp lotion. When I had first started, they were like, oh, the first therapist is like, oh, you can only use this, this, and this lotion. And then the next therapist is like, oh, you can use any lotion you want as long as it's not fragrant. It doesn't have heavy fragrances and whatnot.
Right.
As long as
the shea
okay
butter is really good. You find something with the shea butter.
The first one. Yeah. The first people that fit me for my compression stockings were like, oh, you have to hand wash these and line dry them. And then the next set I got, they're like, oh, throw them in the dryer. It's good for them. So it's so much of it really is just hit and miss and finding what works for you. When I first got my first pair of compression stockings, I had to fight with the insurance company because they counted each one of the pair as a pair. So the right leg and the left leg, that was 2 pairs. And I'm like, the word
that's horrible.
More than one. And so for the first year, I had one set of stockings, and that's all that they would cover. And I believe now because you're supposed to switch them out like every 6 months. And I believe now that with the new rules that they have to do every 6 months, 2 pair.
So let's see. I want to look at the questions real quick. I don't know. Let me see if there was another one. She said, Carrie Boyle, Boyer said, how is your life after the surgery and are the symptoms coming back? So let's take that as a transition now into your surgery. And you've shared a little bit about your trouble trying to find a doctor. And so if you could just share a little bit about your experience with your surgery and any of the other questions, I'll come back, and if we have time, we'll ask Kim, or I'll come back and answer them on the replay on the chat. So it's your floor here. Talk about your surgery a little bit.
Okay. So started with my legs, and he did the front of the legs. Now, the physician I have, am I allowed to say his name or?
He's your doctor.
Okay, so Dr. Volstein in New Jersey. And he does, his normal routine is the front and the edge sides. But because I have so much in my legs, he took out 13 liters off the top, the front, and then has to go back in, and then he'll do the front and the sides again. And so we're alternating surgeries, trying to kind of compress them in a little bit to try and not have this go 2 years. So he did the front of my legs, took 13 liters off, and it basically set me back to like, I don't know, 8-10 years ago.
Wow.
I have an old pair of blue jeans that I put on the other day.
Oh, how fun.
And I don't think it's really changed at this point. The pain or the symptoms from the lipedema. But it is, like I said, it is an improvement, and I can see where it's going. You know, I don't think anybody else is like that. You went all through that and you didn't even notice it. But so we did the 13 liters. He scared me, truthfully. When a physician says it's going to hurt, that means it's going to hurt them usually. I've had procedures where like, oh, the doctor's like, oh no, it's no problem. And it's like, it hurt, So I was really, when he said it's going to hurt, because I wanted to start talking about the next procedure right away. He's like, let's recover from this one first. Because you may
and
not
how long did it take you to recover from it? You were in the hospital for how long?
So I was in the hospital overnight. Because anytime you're doing high volume like that, you have to stay overnight. And so I stayed overnight, and then I stayed locally for a week and did my follow-up with him. And then I think the pain was 1 month, 2 weeks, 2 months. Oh, my husband says 2 months. So I had to have him help me with my leg wrappings and things like that. And so we came home, and he took great care of me. And so you definitely need somebody to help, cook meals and make sure you're doing the things you're supposed to be doing. So yeah, it took about 2 months. And then, so now I'm 4 months out. The swelling in my thighs is, I think, completely gone. I still have swelling in my lower legs, but like I said, I don't know, that could possibly be, lipedema. It could be the lipedema in
from the legs,
or it could be that. But overall, I'm very pleased with it.
But you're walking so much better. I know when I met you, when I picked up those beautiful seashells from you, out in the parking lot, and we talked in the parking lot that day. I said, I think I have lipedema, and we started talking, and you said you looked at my legs and my jeans, and I think you do, with my curves, bumps, and bobbles. So, it's I think that just seeing you now compared to when I first met you back then, I noticed a significant difference. And not only that, but you're walking with more confidence too. You're always been a confident woman that I've known you, but now I feel like you're loving your legs. It's a good feeling for you.
I hadn't realized that, but thank you.
And so you're going back to the same doctor.
Sorry about that.
Yeah, you're going back to the same doctor for your arms.
Yes. Yep. So I actually meet with him on in a couple of weeks, so I'll find out if he's going to do skin and arms at the same time. I'm not sure. I have quite a lot of fluid in my arms, and lumps and whatnot, so I don't know if he'll be able to do both arms and get all of it out the first time. You know, that's one of the things about getting this covered by insurance. If we can get them to cover it earlier,
right,
before your skin is all stretched out, before you're looking at double digit liters, you know, it would just be better for everybody. So I'm hoping that as this becomes more, as we're demanding that they cover this more, that they will start covering it earlier for people.
Now, are you on Medicare now or no? You're younger than me, I think. Okay. Yeah.
Yeah.
So that was one of the things. We've been talking to Michelle Jacqua, who does a lot for insurance coverage for surgeries, and Medicare needs to get on board.
Well, and part of the thing is I did what all of us do, the exact wrong things. So when my legs kept getting bigger, I kept getting baggier clothes to try and hide. You know, I didn't put on compression. I didn't know anything about compression. You know, so if we get the women who are, because, you know, we all know it's mostly starts in puberty that you start to see it, and it explodes with pregnancies. And menopause. If doctors, menopause, yeah, it was really bad for me, I think. Yeah. You know, if doctors start learning about this and catching it younger, you won't end up with women that are in our shape who have spent a lifetime of shame from it,
right,
and hiding it,
and doctors just telling you you're just fat. You know?
Well, yeah, you know, when
on a diet.
When I the first surgeon that diagnosed me was Dr. Gutowski in Chicago, who's, you know, fabulous, and actually had trained at the hospital I worked at in the beginning of his career. So I had gone to him, and he said, well, what did you think it was? And so I thought everybody's fat hurt. You know, it wasn't until I heard that radio program where the woman was saying, you know, that it feels like pearls under the skin and it hurts and all that stuff. And I'm like feeling myself. And then I come to my girlfriend, and I'm like, I know this is weird, but let me feel you're fat.
Yeah.
I mean, we don't go around feling each other's fat.
That's what you did in the parking lot with me.
We don't talk about it.
Feel it. Feel the beads, you know? Yeah.
That's not something that normal people do. But I just thought that's how everybody was. Yeah. You know, I thought I was just a wimp, because if you put a blood pressure cuff on me, I would be crying for, you know,
that's
hours
the first
after.
time I heard about lipedema was, and I stumbled on it. I think a friend of mine said, I think I have lipedema. And I was like, ooh, what's that? You know? And then I started researching it. I found Siobhan Huggins, I always say her name wrong, from Lipedema Simplified. And she was doing a podcast about the blood pressure cuff. And, it's so excruciating. It hurts so bad. And then I found out that not everybody has excruciating pain from that. I was like, oh, okay. You know, it's like eye-opening. Yeah, and now I always take a brochure whenever I go to the doctors, you know, so they know, take it on my wrist. Sometimes I even take my little portable with me if they're willing to use that one. Do it on my wrist. Don't do it here. Do it here. You know, and you have to be your own advocate. You have to push them. You know, it's a lot of the medical, you know, people, they're just like, oh, you're just exaggerating. It's like, no, I'm going to cry if you put that on me.
Yeah. Well, and I actually had one doctor who I was talking to the doctor about the lipedema, and her nurse was over there in the corner Googling it.
Yes, that happened to me. Actually, I asked the nurse, because she kept telling me, you're saying it wrong. It's lymphedema. And I said, no, it's lipedema. I've done my research. I know what I'm talking about. Please go Google it. You know, never got an apology, but yeah, at least she got a little bit of education, I guess, out of it. I never went back to that doctor's office again. Let's see. Do you have any tips for ladies tonight who might be considering surgery, or maybe some healing tips or ideas for if they've had it once and they're going back? Can you think of one or two things that help you that you think, oh, that would be a good thing to tell someone else?
Well, my doctor had me take one of the things that we all go through is the bruising. Yeah, we always look like I've actually, when I'm really bad, I'll tell my husband, if I end up in the hospital, let them know I have lipedema so they don't think you've done this to me.
Right.
Because sometimes the bruises are really bad. And Dr. Volstein has you take pineapple. And it's amazing. The bruising has pretty much stopped. It's still like, there a little bit.
Pineapple juice or just eating pineapple or?
I started doing the pineapple, but then I switched over because, it's too much pineapple is a little hard. Switched over to the capsules.
Oh, I didn't know they made those. Okay.
Yeah, they do. It's bromelain, I think, instead of pineapple.
Oh, right. It's also good for a cough.
It's also good for what?
A cough. If you have a bad cough, drink pineapple juice because of the bromelain.
Oh, cool. But yes, amazing for the bruising. And then he also had me doing arnica. And I for the after the surgery, a little under the tongue dissolving pills.
Oh, okay.
After the surgery, you have a lot of nerve pain, and those really helped with it. I also have, and I think there's a whole lot of us that have a lot of different comorbidities. I have neuropathy in my feet, so I don't have a lot of feeling, and I also am really used to the nerve pain. So that may have been part of why I experienced less pain than it sounds like some people experienced with their procedures, is just I'm already used to that kind of nerve pain. But the arnica really helped with the nerve pain. And then as much as I hated it, just move, wiggle your feet, obviously put them up and keep them up as much as you possibly can for that first 4 months. I was reading last night about pillows, and so I just ordered me some pillows for my arms to get them all raised up for the procedure. I think that was kind of the things that helped the most with my surgery, and just understanding that it's going to take time to heal. You didn't get this way overnight,
right?
It's going to take time to turn back the clock, I guess.
Be patient with ourselves. Be loving.
And you're not going to, and you're not going to get a 20-year-old body after this. That's part of, I had to realize that it's not going to be what it was, before the lipedema started. You've already stretched this body all out. So that's why I said if we could get it to be the normal treatment so that it doesn't get this bad.
Right.
I think back, I had a Girl Scout leader when I was a kid and I used to joke that this is why I ended up with legs like I had before I knew about lipedema. She had horrible, ugly legs, and she only wore dresses because she couldn't get pants to fit, because this would have been back in the 70s. And I can remember thinking, oh my gosh, why does she show her legs, And now I look back, and that poor woman, and she was barely mobile. I look back, and she had lipedema, definitely. And I just feel so bad, as children are not the nicest of things, and that she was suffering with this, and there was nothing she could do for it. And like I said, it did incapacitate her, and that was my fear. I have a husband who's fabulous and helps me do things, but my fear was ending up not being able to get out.
Especially, I just started to say, especially as active as y'all are, on a boat, you got to be a sailboat. Seems like you got to be agile enough to do the things you need to do and enjoy your life, living your best life, right? I know we have so many questions and we got a little bit of time left. Kim, can I invite you? I think you're already on the Lipedema Simplified page, but I'll make sure that you have the link and you could come back and answer some questions to some of the ladies. I know that we've missed a couple of them. Would you be willing to do that? And I'll pop in as well. Okay. So I always like to end my show with asking you, between the words loved, valued, and treasured, which one resonates the most with you tonight and why?
And you had warned me about this question ahead of time, and I had my answer all picked out. And then it's like, oh, I don't know now, because again, I want all three. I told you I was going to want all three. I think loved. I think that when especially we feel unlovable in these bodies, and just knowing that, and worrying about what other people think, and if you really focus on who does it matter. The people that love you, your husband, your children, your spouse, anybody else, it doesn't really matter what the guy walking down the street or the woman, sitting at the beach thinks. All that matters is what your family thinks, and they love you in the body you're in. And I think that when my husband helped me realize that, it really made a difference. Especially, I had said I'm from the Midwest, so you're covered up all the time. And then we moved down here where you just can't wear multiple layers in the summer. You will pass out. And so, and especially I can't, sleeves on my arms just make me crazy, short sleeves or whatever. So I think that being able to love my body and myself, and like I said, just focusing on who does it really matter, what it looks like. If I like what I'm wearing and my husband likes what I'm wearing, it doesn't really matter what anybody else, just the people that you love, and then the heck with everybody else. And so today, that's my answer.
Oh, good, good. And so using that same word, and you kind of gave a little bit of advice in that, but using that same word and speaking to our community of women about being loved, what could you say for a word of encouragement to them?
It's really hard to love what we have, to love yourself the way we are. You look around, and maybe it's jealousy a little bit, oh, look at her. Even she's, as I said earlier, I look at women who are much bigger than me, and their bodies were at least decently shaped. And if we can't love ourselves, we're never going to get past that. So I think you say it all the time about loving your body. And, if we accept where we are now and work from it, which is easier said, it's hard to get the treatment for this. It's hard to find people that understand it. And you can't do all the things you're supposed to do. Nobody could do everything you're supposed to do for this disease. And so you just got to do as much as you can when you can, and start over again. And when you fall and you don't do it today, do it tomorrow, and love yourself enough to put yourself at least at the top of the list of things and people who need to be taken care of. When I said that my legs exploded during COVID, it's because I was going back and forth between Michigan and Wisconsin. And when I was in Michigan, I did nothing to take care of myself. I was taking care of my mom. I was taking care of my sister, and not paying any attention to my body, which, when is easy for us to do, is not pay attention to our body.
Yeah.
And we learn that nothing I do is going to affect the lipedema, but I am a larger woman that it isn't all lipedema. It was I just am not going to deal with it. So, surgery isn't the only answer. As much as exercise is harder for us, and as much as, exercise and building those muscles is harder because of the disease. If you start younger, like I said, it's like now that we know these things, but if you start younger fighting it, I think that'll make it easier.
Yeah, good self-care.
Right. But we just, at this point, you just have to love yourself enough to forgive yourself and keep trying.
Right. And something that I'm in school right now. And so one of the things that I learned today, I'm always all about loving yourself and being accepting and loving all of the bumps and curves and bobbles. But I will sometimes be in the, getting ready and looking in the mirror, and I just talk to my body and bless it. But then this lady today that was teaching, she said, stand in the mirror and say, I love you, Tamara. Or you would say, I love you, Kim. And actually saying that, it kind of makes you choke up a little bit, but then I want to encourage everyone to just practice that. Nobody's going to see you. You're in the restroom, you're getting ready, whatever your protocol is, and just stand there and just say out loud to yourself in the mirror and use your name, not my name. That would be weird. But, like Carrie would say, I love you, Carrie. Or Kiva would say, I love you, Kiva. So just to say that and just to practice that, it's part of loving ourselves. So I really appreciate that. And I appreciate your coming on tonight. Don't go anywhere. We have a couple more announcements. I wanted to let you know, you've probably seen it coming up in the comments a couple times. We have a free webinar tomorrow night at 6 p.m. EST. It's kind of on the same subject of what we've been talking about tonight. And it is, they're going to have more patients coming in and talking about lipedema surgery experiences. So there is a link that you can register for that. I believe they usually have like a replay, but you have to get registered for it so that you can get that if you're not available at the time. So make sure that you sign up for that. We also have another event coming up in April, and it's a 4-day online conference with Lipedema Simplified called Heart to Heart. Oh, it's 3-day virtual. And wonderful, good information. Experts, doctors will have some time to just gather together in small groups and visit and talk and just learn from each other. So just wanted to make sure that that's on your radar and register for that as well. Kim, thank you for sharing your story tonight. Thank you for being vulnerable and showing your beautiful self. I love it. I love your outfit. I love that color. And to your husband as well for, just being so supportive. And I want to tell you, Kim, I'm going to get emotional, that you are truly loved. You are truly valued and you're truly treasured. And I'm so grateful that you're my friend in real life and that we get to hang out together. So we get together and craft together now once a month. So that's always super fun. And to our sisters in the community, know too that you are loved and you are valued and you are treasured. And just to let you know, my live stream coming up in April. Gosh, I can't believe we're coming up on April again. I do this live stream on the 2nd and 4th Wednesdays of the month. So the next one will be on Wednesday, April 9th. And another friend in real life, we used to be in business together, my friend Vanessa Green. She's an expert in essential oils. And I love using natural products on my body and for healing. So she's going to be sharing with us how we can use essential oils to help our lymphatics and pain and anxiety and just bring it. I'm sure she has the answers for you. So she will be with us on Wednesday, April 9th. And again, keep coming in and bringing the questions, and Kim and I will pop in on the replay in the next couple of days and be answering questions for you. Let me see here. Okay, so yeah, I think that's it. I think we're good. And it was a pleasure being with you all tonight and hanging out, and keep coming back and make sure that you sign up for that free webinar that is tomorrow night and get registered for that so that you can get more goodness. Thanks. Take care.
Thank you.
Bye.
Bye-bye.
Kim, stay with us. Don't go away when we